This is a great technique you can use to mobilize a scar or an incision after surgery. This scar on the lateral ankle was from a repair to the peroneus brevis. And so you can see here how it does not move very well, and it's actually painful to touch. The patient also has pain in this area with active eversion and plantar flexion. And so what we're going to do is use this acrylic cup to suction the scar and then move it. I've applied a little layer of lubricant, massage lotion to the area, and then I'm just gliding it first parallel to the scar and then perpendicular. After a couple minutes of this, I will recheck range of motion and assess the end feel.